Last week, President Muhammadu Buhari signed the COVID-19 Health Protection Regulation 2021 as part of efforts to enhance the coronavirus response. One of the major guidelines is that anyone who contravenes the provisions of the regulations risks a fine or a term of 6 months in jail. But many Nigerians have failed to comply with safety protocols like wearing of face masks and social distancing, even as the country continues to battle the second wave of the pandemic. Now, apart from that, many Nigerians refuse to even believe that there is COVID-19, and this continues to put the population in danger. This is part of what we'll be talking about right now. Joining me via Skype from Abuja is public health specialist, Dr. Obinna Eberim. Dr. Eberim, good morning. It's good to have you join me. And let me say Happy New Year. It's the first time of seeing you this year.
Good morning. Happy New Year. And good morning to all the listeners this morning.
Great. Now, you are in Abuja. There are reports of arrests here and there, and then the mobile courts getting busy with prosecuting those who are violating the protocols, the COVID-19 protocols so far. Talk to us. Basically, Nigerians are reacting to this. Some are saying it's a good step in the right direction. Others are saying this should have been on long before now. But what do you make of this?
So I think that is the step in the right direction. First of all, there are some things that we cannot, it cannot be debated. That is there COVID? Yes, there is COVID. And it is evident because we have seen a lot of people die, fall ill of COVID. What people can argue is the severity across countries, the susceptibility across population. But if there is COVID, yes, there is COVID. Now, another point that there shouldn't be any debate about it. Should government do something about it? Yes, the government should do something about it. Yes, the government should protect the population. And the law signed in or the order signed by the president is the step in the right direction, because we are seeing a whole lot of death and a whole lot. In fact, I think that there is even a higher number of deaths that have been unreported, people dying of unknown cause in the local communities. Some of these deaths can be attributed to COVID. So it's a step in the right direction, and I'm happy that this is not just an order like any other order. This is an order that is now being enforced. And I advise everyone watching us this morning, please protect yourself and protect your neighbor. These precautionary measures are not difficult, good enough. There are different types of masks, very cheap ones. You can get a mask, you can use a cloth mask, but protect yourself and protect your neighbor. It is highly irresponsible not to, in a pandemic of this nature, for you to flout these precautionary measures and then put yourself and your neighbor at risk.
Well, protect yourself and protect your neighbor, protect your friends and protect your family. But let's talk about these attitudes generally, Dr. Eberim. The government had expressed its frustration over the years as to people not adhering to the protocols, and now it has left the point of persuasion to enforcement now. But if we narrow it down to the attitudes where people are not adhering to this protocol, what do you think is at the bane of it? What do you think is responsible for these attitudes, despite the information out there, despite even the effort from agencies and the ministries and government bodies?
So yes, our experience in human behavior and health-seeking behavior shows that there will always be people who would behave in this manner. There are people who would doubt even the presence of disease. There will be people who would doubt even the precautionary measures, the safety measures, even the drugs, the vaccine. There will always be those who will doubt it. It's human behavior. But then what do? You do not then allow those people to endanger the greater population.
All right. Now, the issue of flouting of this, we see a lot of enforcement in the Federal Capital Territory. In Lagos, for instance, the government of the state is talking to the people, ensuring that they enlighten the people on a daily basis, and also create avenues where people can, get more information. But if you leave the major cities and go to other states where they are not necessarily in the focus, for instance, recently we hear from Kogi State, where the government there is not on the same page with others who are making efforts to do everything towards COVID-19. These discordant tunes from different parts of the country, and recall that people are traveling on daily basis. Those who are traveling from Kogi State to other parts of the country through different states to the federal, and all crisscrossing the country. How does this compound the whole issue?
So it's a very serious issue, but it's not unexpected. Why do I say so? As I say, there are people who will not believe. So for people of that nature, the high-level stakeholders, you have to go on advocacy, you have to engage them. And you made a very important point. Sometimes we might think we are communicating, we are sensitizing, but are we sensitizing in a language that people can understand, in a voice that resonates well? So we need to do more. I know the government has been sensitizing, has been communicating, but let's now begin to send this communication down to remote villages. Let's use languages, let's use drama, let's use a way that resonates with them. And then another point is, when you're talking about health, you need to talk about the social determinants of health. You need to talk about other factors. Now, one key factor is also poverty. Now, you know that we might think that face masks is cheap, but I must say that there are some people who cannot afford it. So in addition to communication, in addition to sensitization, in addition to enforcement, government should also provide support. So what I'd say is that some of the funds that are sent through social protection, we might use it to provide face masks and some of these tools that are used for precaution to some of the local communities where people are too poor to buy face masks. And then we continue to communicate in a language and sensitize the language they can understand in a manner that can resonate with them. If it's drama, if it's radio, if it's use of town criers. So those are very, very important in addition to enforcement, because even if when you do it very right, there are some people who would not still act right unless you act little force. So enforcement is key, but we must communicate right also, and then provide support.
Okay, let's talk about issues of vaccines now. The Nigeria has been expecting its own package of vaccines. They've placed an order. The first announcement came when government said we're expecting the first 100,000 doses in January. That hasn't come. Again, about 20 million is being expected. So there are statements here and there about the expectation for vaccines into the country. However, there are lots of Nigerians talking about the issue of local remedies, local vaccines. We also saw government at the time encouraging local production one way or the other. Talk to us about that.
So let me start by saying that vaccines work. Vaccine saves 2 to 3 million lives every year. So when this vaccine come into Nigeria, people should make themselves available and get vaccinated and protect themselves and their community. But then talking about there is a global shortage of vaccine. One of the current discussions is how to ensure equity, how to ensure that everybody everywhere that needs this vaccine gets it. Now, that has been responsible for the delay. But one point I want to make this morning, and this should go to government and all policymakers, is that countries are not only protecting their people during this pandemic, they are also taking advantage of this pandemic to grow their economy, to grow their health system. One of the things I think, in my opinion, that we should be pursuing at this moment is local vaccine production, local drug production, strengthen our drug manufacturing and production, begin local vaccine production, because that way, in a situation like this, if it repeats itself, we don't pray that, we would be able to produce vaccines locally. That would make sure that we have it on time. That will make sure that we do not lose foreign exchange. The value of our currency will not go down because we are now buying in a foreign currency. So, and we will also get at a cheaper cost because we are producing it locally. Issues of international transportation will not come through. So it's important that as government, as we continue to protect our people, we should also take advantage of this pandemic to strengthen our health system, to strengthen our.
Right, Dr. Obina Ebirim from Abuja. We just lost. Okay. Yeah, go ahead. That's fine. We have you back now.
Yes. So I'm just saying, in summary, that we have the facility we can build on. We have people who are already working on this. Let us take advantage of this pandemic and strengthen our health system and begin to talk about and implement local vaccine production in Nigeria.
All right. Now, the issue of local production, we hear, at least you are there in the health sector, that it takes a long time for vaccines to be produced because the research, trial and error, trying different formulas and all of that. If we have to start now, I wonder how long it's going to take. But let's get into the concerns a lot of people have regarding the infrastructure to preserve and distribute the vaccines when they come across the country. What are you seeing in that regard?
So I would believe the executive director of the National Primary Healthcare Development Agency, who has come out clearly to say that there is adequate cold chain facility to preserve and move these vaccines. We know that the COVID-19 vaccine requires very cold temperature. Prior to this time, there have been gaps in the supply chain, in the cold chain for vaccines, and there have been call for government to strengthen the cold chain. But however, having said that, we have adequate cold chain facility to transport and preserve these COVID-19 vaccines when they get into the country. We want to believe government because that is key. Because if not preserved at the right temperature, then we lose the efficacy of these vaccines. So the government has assured us, these were questions we as stakeholders have raised, and the government have assured us. So we have to believe them and await the arrival of these vaccines.
All right, let's talk about the enlightenment around vaccines now, because we hear a lot of people talk about the conspiracies around vaccines. They're bringing it to, mutate us into becoming robots, putting chips into bodies and all of that. We hear people talk about all of these things. Some people are going to naturally be resistant to some of these vaccines, especially from the experience during the days of polio and other killer diseases for children. What kind of enlightenment should be going out now that Nigeria is still expecting its own doses of vaccines?
Okay, so yes, so it's important, and some of the things we can do is, first of all, we should keep putting the message out there. But one of the strategies that worked during polio is using influencers. So, for example, in terms of those that have been allocated to receive it, apart from the frontline workers, we need to also select key religious, traditional, and policymakers, people that the people, leaders that the people can relate with. So when this vaccine comes in, we need to vaccinate them because people would react more positively when they see it with their eyes, when they see those that they relate with, those that they believe, those that they trust receive these vaccines. So what we need to do now is that we need to continue sending out the messages. And as I said, it's important that these messages are in a language and communicated in a manner that resonates with the people. We have so many tribes, so many languages in Nigeria. Let's not just use English or the three major languages. We need to communicate in a manner that people can understand. And then when the vaccines come, we need to use key influencers, the religious leaders, the traditional leaders, the policymakers that people trust. Once the people see that they've received it, they are alive, they've not turned to robots or whatever, then people will naturally begin to accept the vaccines. We did it with polio, it worked. We can also do it with COVID-19, and I'm optimistic that we'll also make this work for all Nigerians.
All right. Now, the one other thing a lot of people have talked about is the issue of collaboration between countries and agencies towards this. We know that Nigeria, every country, almost all countries are struggling one way or the other, including even developed countries. But when it comes to the infrastructure, when it comes to awareness, when it comes to distribution networks and networking and all of that, some countries are better off than others. and there is the call to collaborate to create, especially sub-Saharan African countries. Do you see that happening? What is happening in that regard of collaboration between countries?
So I think that there have been collaborations. I have seen collaboration at the African level with the African Union coming together. I think the establishment of the African CDC was timely. I think it just happened before the COVID-19. And I've also seen our own NCDC collaborate with, in fact, I think at a point we were able to share the sequence, the viral sequence. We're one of the first to do that. So I see that collaboration, and I must, this is not to patronize the NCDC. I must commend the leadership at NCDC. If in the past, we wouldn't, if NCDC was the way it was in the past, we wouldn't have had the level of coordination in managing this crisis. So, but that is not to say that we are where we ought to be. There needs to be better collaboration in terms of even vaccine distribution. Countries need to collaborate and make sure that the poorer countries get this vaccine. This is also a time to strengthen global health, ensure that health systems everywhere are strengthened, because what this pandemic has taught us is that what affects the health of a country affects the health of everyone. If Wuhan and China was able to contain this virus very well, it wouldn't have spread across other countries. So we need to look at global health. We need to collaborate and strengthen health systems everywhere.
All right. The president has has made the law that violating the COVID-19 protocols has become an offense. So enforcement is going on. What more can we do to strengthen this so that there can be effectiveness in curbing the spread of COVID-19?
As I said before, sensitization and communication in a language and manner that resonates with the people. Remember, we're a large country. We have over 250 tribes and languages. So we must communicate and sensitize people in a language and in a manner that resonates well with them. Secondly, we need to understand so that other social factors. Our country, there's a large population, proportion of our country that are poor. We need to provide support. We should not take it for granted that, masks are cheap. Some of these tools that are required are cheap. Hand washing stations in schools and all that. We need to provide support because most of a majority of a portion of our country or our people are poor. Then we should also realize that force is not the only option, that there will always be people who won't believe. There are some people who will take time to agree. So we need to use a holistic approach, not just force. We should use a detailed support for people who cannot afford it. We should communicate and sensitize people, and we should also adopt other advocacy strategies like using influencers and people the people can trust. Because when they see those that they trust do it, they would more likely do it than just when they hear a command or an order for them to do it.
All right. Thank you very much, Dr. Obinna Ibirim, public health specialist. Thanks for talking to us from Abuja. Bye.